Hi, this is Dr. Michael Ryan with Missouri Vein Care answering the question, what are the symptoms of a deep vein thrombosis? We hear this question either directly from people, I'm worried about a DVT, or indirectly, which is I'm worried, I'm afraid. And what they're really afraid, and we kind of figure this out, is that they're worried that whatever leg symptom they're having represents a deep vein thrombosis. Deep vein thrombosis is a blood clot in the deep veins of the leg, the veins that are under the surface. You can't see them, you can't touch them, you can't feel them, and so that makes it a hidden problem, and that makes it much more difficult to identify. And so people often with a deep vein thrombosis are walking around with a blood clot that they don't know is there. That is the big risk. So how do you know that you have one? Well, the best way to know if you have a deep vein thrombosis really is going to be eventually to get an ultrasound of the vein. Now, before you get to that stage, what are the symptoms that alert you to maybe I need to get an ultrasound? The symptoms are almost always related to pain in the leg, because when the clot forms inside a vein, a clot is a trigger for the inflammatory system of the body. It's the way the body will heal itself. If you have a cut, a clot forms, and then you get healing. In the case of a blood clot in the veins, the, uh, the trigger for this inflammation will produce recruitment of all the inflammatory cells, and that also produces pain locally. So pain is one symptom. Depending upon the location of the clot, if it's far down in your calf, you may not get very much swelling. If it's at the level of your knee or your thigh, you'll get more swelling. If it's high up in your pelvis, your whole leg will swell. So depending upon the location of the blood clot, that will determine how much swelling you have. So if you have a clot further down in your calf, which is the place where, if you're traveling, for example, in a car or plane, that's typically where those clots develop in the calf. You may not have very much swelling, but you'll have pain, and you'll especially pain when you walk. When you're walking, that is muscle is squeezing around that clot, and it hurts. And it's also stretching the muscle, and all of the sensory receptors around the deep vein are triggered, and it's painful. So pain with walking, pain just sitting there, pain with stretching is going to be the best indicator that you have a blood clot. The next step really is going to be important to get into either urgent care, your doctor, emergency room, to get an ultrasound. One thing to clarify is that there is another condition called superficial phlebitis. That means that a vein under the skin is closed off. It gets a hard, tender red streak or lump, and that is not the same as a deep vein thrombosis. It can lead to a deep vein thrombosis, so it's something that should be taken seriously. But the difference is when you have a superficial phlebitis, that is something people know about instantly because they can feel it, they can see it, and they know there's a tender lump there. And that's something that also should be investigated with an ultrasound, but is not at the same level of risk as a deep vein thrombosis. The reason to get an ultrasound is because there is an association between the presence of a superficial phlebitis under the skin and an accompanying deep vein thrombosis. So you want to know if you have that. So Dr. Mike Ryan answering the question, how do I know if I have a deep vein thrombosis?